When you come to Washington Women Plastic Surgery to discuss breast augmentation, it's not unusual to spend about an hour with myself or Dr. Patrick. That's because breast augmentation on the surface seems like a very simple procedure. However, there's a lot to discuss in terms of planning the procedure, implant selection, and most importantly, knowing that this is a surgery and has inherent risks. We've made this video to prepare you for your breast augmentation consultation, so that when you do come into our office, we can focus the time on your unique history and anatomy, your goals and desires, and ultimately, what procedures can be options for you. I'm Dr. Catherine Hannan, and on behalf of my colleague, Dr. Lauren Patrick, I would like to thank you for considering Washington Women Plastic Surgery for your breast augmentation journey. The decision to pursue any surgery is a serious one, and we'd like to provide some important information about the process, risks, and benefits to help you decide if breast augmentation is right for you. So let's start with who are candidates for breast augmentation. We hope that you're in good health and within or near your ideal body weight. You should not be planning on pregnancy in the immediate future and should be at least 1 year after nursing to allow full shrinkage of your breast tissue so that we know how much you actually truly have. If you are over 40 or have a family history, you should have a mammogram within the last year before surgery. If you are a smoker, you should stop using any tobacco products for at least 6 weeks prior to surgery. And lastly, you should have reasonable expectations. Every breast is different, and there is a narrow range of implant sizes that will fit your body. We should spend a moment talking about types of implants. You can choose a saline-filled breast implant or the more popular silicone-filled implant. The most important fact to remember about both of these implants is that the shells are both made of silicone rubber. All silicone implants currently available on the market in the US are cohesive, meaning if they rupture, they don't leak and stay in place within the scar tissue capsule that your body forms around the implant. However, like other devices, they will eventually fail and the shell may crack. Most studies that we know about estimate the average rupture rate of the older available implants, including Sientra, Allergan, and Mentor, at 0.5 to 1% per year after placement. This means that by 10 years after surgery, about 10% of implants will have ruptured. The most recently approved Motiva implant has a less than 1% rupture rate in worldwide studies, but even these will eventually fail. Even if your silicone implant ruptures and you have a crack in the shell, you may not know about it because of how cohesive the current implants are. That is why the FDA mandated in 2006 that surgeons recommend you obtain an MRI every 2 years to check for cracks. MRIs are the most sensitive way to diagnose that problem. But just because you make it to the 10 to 15 year mark with implants doesn't mean you have to come back and get them changed out. If your implants are soft and you're happy with no major changes, you just keep going with them. Detecting an implant rupture is much easier with saline. If it ruptures, the saline will just get absorbed in your body, and you will know fairly quickly when that breast starts to shrink over a period of a few hours, days, or weeks. First thing we should talk about incision placement. The one that we use most commonly is the inframammary fold, or where your underwire line sits. It is hidden well in a bra or a bathing suit and allows for direct access to create a very specific pocket for the implant. Additionally, several studies show a lower rate of infection and capsular contracture using this incision compared to other access incisions around the areola or in the armpit, for example. Moving on to the pocket where we place the implant. We can either place the implant above or below your pectoralis or push-up muscle. For the majority of our patients, especially those with very little breast tissue in the upper pole, we have traditionally placed breast implants under the muscle to prevent rippling or obvious appearance of a breast implant. Additionally, there were safety considerations for placing the implant under the muscle, as data showed a lower rate of capsular contracture with the long-standing implants on the market available in the US, including Allergan, Mentor, and Sientra. The downside to placing the implant under the muscle is that we do have to cut a little bit of your muscle, and it tends to be pretty sore and the muscle very tight and crampy for a little while after surgery. Just recently, in October 2024, the latest 6th generation cohesive breast implants by Motiva were approved for use in the United States by the FDA. The studies required by the FDA for approval had 3-year follow-up and showed less than 1% rate of infection and capsular contracture. These implants have been on the market worldwide for over a decade, and that data from those countries confirm these low complication rates. There are several other features of these implants that make them more favorable to place above the muscle, including the 100% gel fill and monoblock technology that allows the shell, the patch on the back, and the interior filled gel to move as one cohesive unit with your tissue. For these reasons at rest, they show less rippling and we believe will be more aesthetically pleasing and naturally shaped when placed on top of the muscle. Let's talk then about some short-term complications. Bleeding and infection are complications that can happen with any surgery. Infection can be truly serious with breast implants. They are foreign bodies, and if bacteria get on the implant, despite antibiotics, they may need to come out. With conventional implants, a 1 to 2% infection rate has been reported, and the newer Motiva implants are reporting a less than 1% infection rate. For intermediate-term complications, we want you to know that 1 in 5 women will have a second surgery within 5 years after the implants are placed. Luckily, a good majority of these surgeries are not due to a truly medical complication, but because these patients wish they had chosen larger implants and are electing to upsize the ones they have. But one of the more common true complications that can happen, usually within the first 2 years, is something called capsular contracture. With any injury to the body, including surgery, the normal healing process involves making collagen and scar tissue, including around your breast implant. In some patients, that scar tissue can become thick, tight, and painful. This has been reported to happen in up to 19% of patients in their early 10-year data for Allergan, Mentor, and Sientra after they were reapproved in 2006. We don't fully know why some patients develop capsular contracture, and many of those patients that do get it tend to get it again despite surgery to correct it. Much of the current research suggests that it is related to a very low-grade infection causing something called biofilm. It is for these reasons, including both risks of infection and capsular contracture, that Dr. Patrick and I take sterility during these procedures incredibly seriously. Part of our protocol involves using the inframammary fold or bra line incision, covering your nipples with a sterile protective dressing to prevent any bacterial contamination that could occur from the milk ducts in the nipple. Changing sterile gloves just prior to placement of the implant, use of a sterile insertion sleeve that allows for a no-touch technique, and only a single surgeon manipulating that device. We are encouraged by the data on the Motiva implants showing a less than 1% risk of capsular contracture. This is thought to be due to their unique proprietary smooth silk surface that is more favorable towards your tissue, causing a lower inflammatory response. Finally, for the long term, we'd like you to remember some really important points as you consider breast augmentation. Remember that you'll likely need at least one other procedure in your future, either to remove the implants or replace them, or possibly even for a breast lift as the breast tissue and skin stretches over time. Weight and gravity, as well as pregnancy and nursing, will stretch your breast tissue and likely cause your breasts and nipples to drop. Also remember that larger implants cause more weight on your tissue and therefore more stretch as gravity and age-associated loss of collagen in your tissue takes hold. And there are 2 last things we are required to talk about. The first thing we have to address is something called breast implant illness or systemic symptoms associated with breast implants. In the late 1980s and early 1990s, the quality control for silicone implants on the market was not ideal. Many patients thought they were getting systemic illnesses from their silicone breast implants. Therefore, the FDA banned them in the US in 1992. They were then reapproved for use in 2006 with the condition that the manufacturers had 10-year follow-up data on their patients and devices, and that all patients had to be over 22 years old and were told to obtain screening MRIs every 2 years to look for rupture. Again today, many patients with breast implants have complained of a constellation of symptoms such as fatigue, brain fog, joint pain, rashes, hair loss, as well as many other systemic complaints that they believe are directly caused by the breast implants. No study to date has been able to find a direct causation between the presence of implants and these global symptoms. However, what we do know is that these patients truly are suffering, and many do feel better when their implants are removed. The second major point to discuss is BIA-ALCL, or breast implant associated anaplastic large cell lymphoma. This is a very rare blood cell cancer related to and within the scar capsule of breast implants. The first case was documented in the 1990s, and to date there are about 1,500 cases known worldwide, with 63 reported deaths. Symptoms usually occur on average 7 to 10 years after the implants were placed and typically present with a sudden swelling and enlargement of one breast. When detected early, the treatment is surgical removal of the implant and the capsule and is highly curable. Fortunately, all known cases are documented to have occurred in patients with textured or rough shell implants. The working theory about why this occurs seems to be inflammation, either from bacterial contamination as well as due to the specific texture of the implant, most commonly Allergan BioCell, which was removed from the market in 2019. The risk of ALCL in patients with those rough shell implants is thought to be 1 in 2,000 to as low as 1 in 86,000. Based on the data that we do have, we do not believe that smooth implants that we currently use are associated with ALCL. I want to thank you for watching this video. I hope we've provided some useful information to help you in the decision-making process. We look forward to meeting you at your consultation at Washington Women Plastic Surgery. During that time, we will learn more about your medical history as well as your goals for breast augmentation. We'll take measurements and photographs and discuss the type of implant as well as the size ranges that will be custom suited for your body. Thank you for your time today.